Dakshina Kannada and Udupi district, known as the educational hub of Karnataka, boasts of 7 dental colleges of academic excellence within a radius of 70 kilometers. Each of these institutions in their strides have done their best to go a step beyond providing basic dental care and creating awareness amongst the local populace. Today, we, the Department of Periodontics, Srinivas Institute of Dental Sciences, take this opportunity to rise and share our responsibility in taking this goal a step closer to the community. In Short 7, a video making competition organized by Srinivas Institute of Dental Sciences takes the lesser known facts of oral hygiene to the general public. We, the 7 Dakshina Kannada in the south, we move further to the next college, that is A.B. Shetty Memorial Institute of Dental Sciences, standing tall in Derlakatte, followed by the Yenapoya Dental College in the adjacent campus. From the heart of Mangalore city, we have the Manipal College of Dental Sciences, Mangalore. And marking its presence on the National Highway 66, we have the A.J. Shetty Institute of Dental Sciences, Mangalore. We finally conclude with the northernmost dental institute of Dakshina Kannada, the Manipal College of Dental Sciences, Manipal.
A very good morning to our dear guests and a warm welcome to all. Myself, Dr. Shiana D'Souza, Reader, Department of Periodontics, moderator for today's program, Oral Hygiene Day 2021. I now request Professor Dr. Chandni Sri Kumar, Head of the Department of Periodontics, Srinivas Institute of Dental Sciences, to deliver the welcome address.
Respected President, Shamarao Foundation, and Chancellor, Srinivas University, Shri C.A.A. Raghavendra Rao, Vice President, Shamarao Foundation, and Pro-Chancellor, Srinivas University, Dr. A. Srinivas Rao, our chief guest of the day, and my teacher, Professor Dr. Anil Melat, our beloved Dean, Professor Dr. Manoj Verma, Associate Dean, Professor Dr. Lavanya Verma, heads of the department and staff, Department of Periodontics of A.B. Shetty Institute of Dental Sciences, A.J. Institute of Dental Sciences, Manipal College of Dental Sciences, Mangalore and Manipal, Yenapoya Dental College, and KVG Sulya, the heads and staff of our departments in Srinivas Institute of Dental Sciences, and our students, the participants of today's program. A very good morning to each and every one of you present with us here on this virtual platform. World Oral Health Day is celebrated on the 20th of March, and it aims to highlight the benefits of good oral health, spread awareness about oral diseases, and promote the maintenance of oral hygiene. We Indians are only proud and happy to further this cause on the 1st of August, celebrating Oral Hygiene Day in the memory of the birth of Dr. G.B. Shankwalkar, the founder of Indian Society of Periodontology. The theme chosen for the World Oral Health Day 21-23 is Be Proud of Your Mouth, a simple but a very powerful message. This campaign aims to spread the message that oral health is significant for overall health. For a longer and healthier life, oral health is a must and should be taken care of. In these tumultuous times of the COVID-19 pandemic, where we have to take care of ourselves and our loved ones and do everything we can to avoid visits to hospitals and clinics as far as possible, we, the healthcare providers, as much as our primary goal is to treat patients, our ultimate responsibility and long-term goal is the prevention of conditions that may need our help. Various organizations and institutions have already taken the initiative towards educating the masses globally. Keeping in mind this motive and spirit of creating social awareness about oral health, we at Srinivas Institute of Dental Sciences organized a video making competition for our 6 neighboring dental colleges. I must say, I was both motivated and encouraged and grateful by the energy, creativity, and effort shown by the students and staff of the participating dental colleges. The message is very clear. As we create a culture of social and moral obligation and responsibility in our students, tomorrow's doctors, we, today's doctors, are not shying or wavering from doing our bit towards creating a healthy society free of all oral problems. On a lighter note, today we pledge to make our society and country free of all the very same problems that created or made our profession a financially lucrative one at one point. Coming to today's program, our chief guest requires no introduction in the perio and dental circles. Like me, thousands have been privileged to have been his student and of knowing him personally. Sir, today it is my pleasure and honor to have you with us. I request our Dean, who has always been enthusiastic and encouraging in every step that helps students and benefits the patients, to introduce our chief guest of the day, Professor Dr. Anil Melath. I also request the Dean to speak a few words. Over to our beloved Dean, Professor Dr. Manoj Verma.
Hello everybody, we are here today opening up on the Oral Hygiene Day, which is to be commemorated on every 1st of August, first coined by the Indian Society of and ever since then, it tried to conduct awareness in periodontics in the masses by getting oral hygiene awareness to one and all. So to commemorate this Oral Hygiene Day, many people have come forward from institutions and various levels of colleges to get in forefront and spread the awareness so that they can take care of their oral health. We from Srinivas Institute of Dental Sciences have been conducting programs right from the inceptions with a lot of programs. I remember to say marches in the streets, skits. We had even gone to the police quarters and spreading awareness. So thereby our institute has gone length and breadth to spread this awareness. So this year, with relation to COVID being dominant, we are trying to spread the awareness through the media. I have to say that my department of periodontics, heading by Dr. Chandini and Dr. Deepa, Dr. Shian and the rest, are taken initiative to have this Oral Hygiene Day being conducted in such a way that including all the neighboring colleges and the colleges in the district of Dakshina Kannada as well as Udupi, getting all the students together to have a competition in oral hygiene so that they start at this grassroots level. As they grow older, they have the fundamental stuff in them so that they can spread the oral hygiene awareness right from this day. So we are having competitions which will be conducted by the department under their guidance. To inaugurate this particular event, we have none other than Dr. Anil, Principal of Mahe Dental College. colleague and the convener of the program, about Dr. Anil. Nevertheless, he's a great friend. I know he's been there in this field from long. He's been the past president of Indian Periodontics. He's got a lot of accolades in his armory, and it will all be spoken about in a short span of time. I wish the organization all the very best. I wish all the students of all the dental colleges participating good time and good luck. I thank Honorable Chancellor Dr. C.A. Raghavendra Rao, President of Srinivas Group of Colleges. I also thank Pro-Chancellor Dr. A. Srinivas Rao, Vice President of Srinivas Group of Colleges, for having encouraged us and giving us all the strength and guidance to come up with such programs so that we could come up with such health activities to reach the masses and thereby empower them to have the treatment. Thank you.
Thank you to our beloved Dean, sir. Our guest speaker for the day, Professor Dr. Anil Melat, sir, graduated and completed his MDS from A.B. Shetty Memorial Institute of Dental Sciences, where he also started his academic career. After having worked as a professor in Coorg Institute of Dental Sciences, he joined as a professor and head of the Department of Periodontics, MAHE. Currently, he is the principal of MAHE Institute of Dental Sciences and holds the post of head of the Department of Periodontics. He is a sought-after orator in various national and international platforms with a roaring private practice. To his laurels, he has Most Proactive Senior Academician in Periodontics 2019, past President of Indian Society of Periodontology, President-elect of ISPRP. So, it's my pleasure to welcome our chief guest, Professor Dr. Anil Melat, sir, to share his valuable thoughts regarding the importance of oral hygiene.
Thank you. Can you hear me? Am I audible?
Yes, Dr. Anil.
Yeah. Good morning, respected Dean of Srinivas Dental College, Dr. Manoj, who is also my good friend, Dr. Lavanya, Dr. Nitesh, head of the Department of Perio, Dr. Chandni, Dr. Deepa is there if I'm correct, Deepa Shetty, then the entire team of Perio, faculty of Srinivas, and dear students. First of all, I thank Dr. Manoj and Dr. Chandni for inviting me for this Oral Hygiene Day function, and congratulate Manoj because seeing the progress made in an institute of a short span of time, it's really credible, and I know the effort what we take to take the institution to this level. So congratulations, Manoj, and I'm sure that under your leadership and with your able faculty, we will scale more heights. And we know that today Srinivas is one of the pioneer institutions in the country, academically, as well as in all activities as such. So
Thank you so much, Dr. Anil. Likewise, it's a similar thing from your side in your institute. So I would cut it right here so that you can take the event forward.
Yeah, okay, right. And it's nice to know that during this Oral Hygiene Day, that regular programs are happening all over the country. Actually, tomorrow is Oral Hygiene Day. And it's nice to see that you have done a competition with including all the colleges in and around Mangalore, which is very nice, because that shows increases the awareness among the students. It increases the awareness among the public as well. So basically, we conduct this Oral Hygiene Day as such to improve the public awareness of the periodontal disease as such, and very importantly, oral health. So I directly go to my assigned duty. I will share the screen now and start a small presentation about Oral Hygiene Day. Is it okay? Visible?
Yes, sir.
Yeah.
This-
So already it has been mentioned that we all know that Oral Hygiene Day is basically we celebrate the birthday of our stalwart and peer, one of the first periodontists who initiated the Indian Society of Periodontology, called as Dr. Govind B. Shankwalkar. He was a Bachelor of Dental Surgery in the University of Bombay in 1954. And he started the first master course, first postgraduate teacher in the country to start MDS course in periodontics at the University of Bombay. So in a national level, we actually conduct Oral Hygiene Day to actually celebrate the birthday of Dr. Govind B. Shankwalkar. And he was a faculty and dean of Government Dental College in Mumbai. And for us, he was the first president of Indian Society of Periodontology. Now, when you talk about Oral Hygiene Day, oral hygiene as such, now we see that next to common cold, when you see the survey in many of the literatures, they say that next to common cold, the disease commonly seen is gingival or periodontal disease. But when you come to the clinical practice level or when you come to the awareness among the public, we actually are lagging behind in identifying as well as the public are not self-identifying the disease, where we have to have an awareness completely to generate among the publics. And that is what we are taking as an initiative from the periodontist side as such and from the Indian Society of Periodontology as such. Now, when you see that you achieve in a patient what is smile, it is easy to say that because a lot of components which are involved in this. We all know that the gingiva plays an important role and the periodont supporting structures plays an important role. The crown plays an important role. So all these are factors which contribute to something called a smile. And overall, above this, there is something called as oral hygiene or oral health, which definitely keeps the smile intact, which creates a lot of problem if not taken care, and which we are trying to do an awareness among the public by educating them about the importance about brushing, educating about the maintenance, educating about identifying the type of gingival and periodontal disease. So in national level, we are conducting a survey from the Indian Society of Periodontology to get into the public in zone wise and then create awareness among the periodontal diseases among the public, which we will be taking initiative from the colleges, help from the colleges as such, which is in the process and immediately it will be done within a year. Now, oral cavity, we know it's a mirror of general health. And we know that what health means basically it's a complete physical, mental, and social well-being. Many times in the clinical practice, we have seen that patients who are diabetic or patients who are hypertensive, we can see changes in the gingival consistency. We can see that there are definite changes in the gingival consistency. So many times we identify the patient won't be knowing. We have identified through the changes occurring in the gingival surface, telling the patient to go for a blood checkup. So, and they find it positive. Or I find it that there is a prevalence of diabetes or the prevalence of hypertension, which the patient is not aware at all. So oral cavity is definitely a mirror of general health, and it is a gateway for systemic health and disease, which has to be very, very importantly educated and motivated the patient. Many times when the patient comes to me in the clinic, when I asked when the patient comes and complains about the bleeding gums, many times I ask the patient how long it has been bleeding. So I think in all your clinical experience you would have had, they tell that 6 months to 1 year it was there, and they're not much aware about that. But I ask them, if you have a bleeding from nose or ear or eye, immediately you run to the doctor. But if bleeding gums, they are not aware or they're not taking it very seriously. So we have to get into the public for the same. And because since the oral cavity is the mirror of general health, we should identify at the earliest if there is a systemic component, which will definitely benefit the patient as such. Now, when you see about what are the things what you have achieved by giving good oral health is, first is physical and mental well-being, and you can prevent disease and dental caries and stimulates the appetite, prevents halitosis, stimulates salivary section. These are the components normally when you talk about what is a good health, what is a good oral health or a good oral hygiene as such. So automatically it comes to a circle where the patient's physical and mental well-being is directly correlated with the oral health as such. Now, health and disease, we know that all the students, we would have we in the final year or examination, we basically want them to identify what is normal and what is abnormal. And clearly we know that what are the gingival lesions, what are the periodontal lesions, what you encounter in the clinical practice or in the institutional level. So you have to identify the health and disease as such. So now in this case, when you say about health, oral flora in the adult human saliva, it contains 6 billion microbes. So they say that it is more than the population on the earth as such. So in this, we can say that when there is an environment which is created, or when there is an environment for the pathogenic bacteria to grow, you have already these microbes there acting as a pathogenic bacteria and then initiating the disease as such. So there is always a chance that once the oral hygiene is not maintained, there is a activating factor there which can create the problems later, initiating the gingival and periodontal disease. Now we have come to the stage where periodontal medicine, where we say that oral cavity is a gateway of systemic diseases, and it is connected to various systemic diseases as such. There is a two-way relation, where a lot of literature showing that periodontal disease causes diabetes, periodontal disease causes premature delivery and preterm low birth weight babies, periodontal disease causes cardiovascular diseases. So all these are linked, systemic and the oral health as such. So much importance is there. But so with same importance, so much of literature from the medical side also, this has to go in tandem with the medical doctors as such, and then get into the public, signifying the disease what an improper oral hygiene can cause. So this year we had a joint symposium with our Diabetic Society, National Diabetic Society, and we made a beautiful article or beautiful literature on the combination of diabetes and periodontal disease, which was released. It's called as a guided protocol between the two-way relationship between diabetes and periodontal disease. So which was equally shared by the Diabetic Society and the Periodontal Society. So much of discussion, and we made that GCP guidelines, and then it was contribution was equally from the diabetes and from the Periodontal Society as such. So it is so much important to get into the awareness of even the medical people to understand the importance of oral hygiene, which we are slowly achieving by getting into them and having discussions with them, so that which is very, very important. So to add on to that, I will just show that one video how oral cavity is the gateway for systemic diseases, so that you will get a better idea.
In many ways, your mouth is the gatekeeper between the outside world and the rest of your body. Your mouth is teeming with billions of bacteria. There are more bacteria in your mouth right now than there are people on Earth. Over time, these bacteria can stick together and multiply. They form a colony, and the colonies can then join together, forming a thick layer called a plaque biofilm. This can eventually spread across every surface of your entire mouth, your teeth, your gums, your cheeks, and your tongue. Every small space in your mouth provides the perfect environment for bacteria to thrive and for the plaque biofilm to grow, which it can do dramatically over the course of a single day. Your mouth's inflammatory cells are activated to kill the bacteria, but the bacteria can build strong defenses within the colony to stay alive. These inflammatory cells, which are designed to protect the body, can then cause harm in the form of gum inflammation, also known as gingivitis, the earliest stage of gum disease. People with diabetes are even more susceptible to gum disease because their blood vessels are compromised. The area between your teeth and gums is densely packed with
Anil sir? Hello? I apologize for the glitch condition.
Hello, Dr. Anil. Hello, Dr. Anil. I think the video has stopped. Dr. Chandani, is it so?
I think, sorry, it got cut.
Yes, sir, we're contacting him. Yes.
Upright. A debilitating disease of inflammation in the joints, or preterm low birth weight in infants, which may be linked to bacteria passed from the mother to her fetus. Good oral care may positively affect your overall health, which is important because what happens in your mouth may not stay in your mouth.
Okay, so this video will give you a clear-cut idea that already there is a microbial flora available there. So any negative situations, there are chances of pathogenic bacteria getting activated and creating the leak. And probably only think what generally in the clinical practice, what when we address the patients, the possible factor why the patient doesn't turn up in case of periodontal lesions or in case of gingival inflammation is because there is comparatively less pain when you compare with the other endo situations. So many times they take real time. So it is our duty to make sure that you educate and motivate the patient, you educate and motivate the public, because this periodontal medicine, the periosystemic link is one key factor which a lot of discussions are going on and a lot of literatures are actually available on the same. So it's connected to diabetes, it is connected to cardiovascular, it is connected to pregnancy and many medical systemic situations. So it's basically a two-way relation. And I think majority of the postgraduates in India, they do a study on the same, and we can see that when you treat periodontal disease as such, there is a reduction in the systemic component as such. So much importance have to be given to oral hygiene, maintenance, and to control the gingival and periodontal disease, which is very clearly, they have in the video, they have described about how the oral cavity is going to be the gateway for systemic diseases. Now, this is a disease. We know that what is gingivitis, what is periodontal disease, all this, I think already you will be taught, and definitely in the clinical situation, we know to make out the clinical condition also. Now, among all this, an improper oral hygiene, we know that all this other components like caries, gingivitis, halitosis, periodontitis, tooth loss, systemic illness is one periodontal medicine component which is very, very significant among the other. So it is very important to maintain the improper oral hygiene. And among this, one more group which I've seen is the halitosis. I don't know how many would have got patients with halitosis in the clinical practice, because when patients do have halitosis because of improper oral hygiene or many other reasons, because of digestion factors, because of any other factors related to a systemic illness, the problem, because they are not aware, or you see their body language, they don't see you or they don't speak to you directly, because that is completely creating a psychological block for them. So that is the difficult type of patients, what I feel that when you have an halitosis, the patients to manage. How to manage, so that's one significant thing what we are looking at. So all revolves around something called as improper oral hygiene, and which adequate importance has to be given to. Now, to overcome this, we all patient side, you need to make the evolving personalized care environment, communities of interest, interprofessional education, collaborative care. And all this should be competent, and you should assess the condition. And this is a model which the future model, what we have to think about in maintaining the oral hygiene. Although we say that oral hygiene, when you say or maintenance of oral hygiene is very an easy way to put it, but I think that requires so much of significance which has to be given. Many patients come and ask me that I brush 2 times, but still you can see a lot of deposits on the tooth surface. and how there is a deposit on the tooth surface. I put it in a simple way. I tell them that when if you have a vehicle, after 5,000 or 10,000 kilometers, you go for a survey. The same way, you have to have a professional cleaning, which has to be done regularly, which makes the oral hygiene perfect, or which makes the oral hygiene adequate enough without any infection. So this is how you get into patients with the layman terminologies and get into them and make them involved about the importance of oral hygiene. And nowadays, it's nice to see that this year, around 123 dental colleges are celebrating the Oral Hygiene Day with a lot of programs. And I think the best, we have an Oral Hygiene Day competition also from Indian Society of Periodontology. And it's nice to see that colleges like Srinivas are doing in and around good programs to spread the word of oral hygiene importance. Now, when you talk about this, we have just finished the periodontal medicine part. It's always better that don't just localize yourself. When you see a patient or when you see there is a good oral hygiene, but still there is a bleeding component, always think that there is a systemic component also involved in that. So many times it is when you treat the oral diseases, it's better to have the systemic component looked into it properly so that you don't get into just a prophylaxis and then further lead into various problems as such. So considering all the periodontal medicine part, you have to think about the importance of the periodontal medicine or the systemic component link. For a simple example, I'll tell you, I had one patient coming to my clinic when I was working in AB Shetty. So she had only the gingival overgrowth on the posteriors. There's no other problems. So, and her complaint was slight bleeding. Posteriors, there was gingival overgrowth. And there was no, absolutely, we normally correlate with the local factors, but there's no local factors as such. So I sent the patient to the KSAKD hospital, and it was acute lymphocytic leukemia. So the only presentation was on the gingival surface. So it's very important to identify. Just don't get into do a gingivectomy or get into the procedures, because always correlate with the local factors, then always correlate with the systemic component, do all the tests, because definitely oral cavity is a mirror of systemic diseases. Now we have regular toothbrushing, all this toothbrushing, and you have power toothbrushes which are available, and different all irregular aids what we have. You have water pick irrigators, you have interdental brush, use of mouthwash, use of interdental floss, everything. But many times what we do is, you understand that toothbrushing, whichever way you teach the patients as such, because they are convenient in it in one mode, because I stress normally on the change of toothbrush, one use of soft toothbrush in periodontal diseases, and specifically on the use of mouthwash and interdental aids, which is equally important, because open contacts or when there is a spacing because of periodontal disease, post flap, all this thing, because oral hygiene is a key part. And we have a chart prepared for the patients in case of if you are doing a periodontal flap surgery, and or if you're having a routine oral hygiene status, we keep a chart. And on this chart, we have a schedule of the revisits, which is very, very important. And that makes actually your oral hygiene maintenance complete, because many times we see that patient doesn't come back, how much ever you tell or spread about the awareness about the oral hygiene as such. Now, so it's very important to visit dentist every 6 months, because along with your professional treatment, maintenance is one thing which is very important and which we have to specify to improve the oral hygiene as such. Now, I'll just quickly go through the 3 cases. Chandani has given me only 20 minutes, but I'll just rush through. That's why I'm rushing through. So in a cases like this, where you can see the abscess here, there's a periapical abscess, make sure that you take an active, which understand that which in cases like this, where you have 4 or 5 crowns, which is given, where you have an active lesion, make sure that you touch the active lesion only by using a GP tracking the active lesion. Many times we see that, I see that in case of, they confuse between gingival periodontal abscess and periapical abscess such. Now, simply when the treatment line is totally different, because in case of periodontal abscess, you can see this, you use a periodontal probe, it accesses the sinus down. So it is not a gingival abscess, or it is not a periapical abscess. When in case of periapical abscess, you cannot pass the probe through the gingival surface and reach the sinus. So this is how you easily make out the difference between the periodontal, gingival, and periapical abscess, because all three, the treatment line is totally different. Why I'm stressing on this is because I'm going to a couple of cases where I'll show you what treatment line have been done. This is a case which had come to court, I show it everywhere possible because it's a different case, where you can see that there is a tattoo here. There is a tattoo here. The patient had gone to one of the private practice and they had a lesion here. They have done immediately the episectomy and did a retrograde filling. They never did a root canal treatment as such. So you can see after the debridement here, only this much root is left. The label plate is completely gone. So we did a debridement, we removed the silver restoration and then did a bone graft and then went ahead and did a, after 6 months, you can see properly healed. There is less of mobility, there is no exudation, but still you can see the tattoos here. So the second step after 6 months, we excise the tattoo and then you can see this sutures placed and see the difference now. So this is one case what we have treated. So I'm just analyzing, I'm just showing the importance to students of how clinical perio work, because you can see initially we did a proper flap with bone graft, then followed by we did a excision surgery, took a Friedgen graft and did an aesthetic surgery, and you can see that perfectly. Now I can go for a beautiful crown on this. The second case is in certain cases like this, where you can see a lesion here, where this is because, I think this is because of the trauma, which only one root is resorbed here. We opened the flap and we did a RTR cone grafting, and you can see that it's beautifully healed. So tissue response is so good because if you identify the cause of the lesion and then go ahead with the treatment plan as such. So this is specifically because students are there, I'm showing that perio is not only scaling, because many times we understand that when you go to the final year or when you're after final year, because students are not interested in taking the perio because they think it is only your scaling process as such. So in our institution, what I'm doing is from third year onwards, they give only 5 hand scalings, and from that they start off with ultrasonic scaling, and finally they do minor surgeries to create an importance, and they'll understand what the surgical field of periodontology is as such. And this is one more case, last case, where you can see that there is a recession here. We have taken a connective tissue graft and then placed, and see the result what you get. This is not only because of the coverage of recession, even for a restoration, when you're placing an anterior prosthetic work, you need an adequate attached gingiva. So this type of work we can do, and definitely which will also see in this case, when you see the difference, now the patient can maintain it well, oral hygiene can be maintained well. So a lot of clinical work, clinical periodontology is what we do rather than just doing the oral prophylaxis. And we have bone grafts, which I showed you. And after that, make sure that we have to maintain a protocol. Inadequate plaque control, normally we have 3 months recall for the visits, and then make sure that you do the scaling and then patient maintains completely about this. Third is, in case of adequate plaque control, you analyze the bone loss. If it's 80% or more, then we go for an extraction. 80% or less, we have all the flap surgery and the bone defect, which is available as such. So these are different procedures, which I just, along with this, I showed because it's a case of different interest. And very importantly, use of proper technique, proper case selection, and patient motivation definitely leads to successful periodontal treatment. So make sure that you educate and motivate the patient, make sure that you spread awareness among the public about the oral hygiene, and more importantly, you be the leader in showing the way toward a good oral health. Thank you once again, Chandani and team, and Manoj and team Srinivas. Thank you so much.
Thank you very much, sir. I'm sorry this is not in the program, but after your talk, I just had to tell you, you took me back by 18, 19 years. It felt like I was in your class, attending one of your classes. I think you have done more justice probably than what you have done 19 years back, if that is possible. One more, now you have put pressure on us. I'm sure our students are also going to expect the same thing. Surgical cases, I don't know how we are going to manage that, because till internship we have not started all that for us. But having said that, I am sure a lot of people have been motivated to take up periodontics after listening to your talk, sir. Thank you very much, sir. Over to Dr. Shivan.
Thank you, Anil sir, for your educational presentation. As you said, sir, early detection is the key to prevent oral disease. And this can be achieved by creating awareness and reaching out to every sector of the community, which is a role and duty of every dentist. Thank you once again, sir, for enlightening us.
Thank you.
As a part of celebration of Oral Hygiene Day 2021, Oral Hygiene in Short, a video making competition was held and was judged by young and dynamic periodontists. Professor Dr. Sachin Shivanaikar, Maratha Mandal NGH Institute of Dental Sciences, Belgaum, and Dr. Daya S. Reader, Bapuji Dental College and Hospital, Davangere. Thank you to our judges. I request Professor Dr. Sachin Shivanaikar, sir, to share his experience of judging the video competition.
Jai Hind and good morning, one and all. Respected Dean Sir, Dr. Manoj Sir, Chief Guest for the function, Dr. Anil Sir, Head of the
Dr.
Department,
Sachin,
Dr.
you're
Shani
not
ma'am.
audible. Sorry to interrupt. Yes, you are.
Can you hear sir now? Can you hear?
Yes, we can hear you, sir.
Okay. Firstly, I would like to congratulate the Department of Periodontics, Srinivas Dental College, for organizing such a beautiful event and for conducting such a competition on oral health and oral hygiene and its awareness program. And to recollect my experience with the Srinivas Dental College, I got an opportunity to be as an examiner, external examiner in the year 2018. And this is the only institute which I still remember because the students were outstanding and they had a lot of innovative ideas where they had kept a lot of oral hygiene models in their museum. So this is one of the institute which I cannot forget. And thanks to Chandni ma'am and her entire team for inviting me as a judge for this program. And thanks to one and all. Thank you, sir.
Thank you, sir. I would also ask Dr. Daya S. To speak a few words.
Good morning, everyone. Firstly, I love Srinivas Dental College, HOD, Dr. Chandni, Shian D'Souza, my friend, and also Dr. Deepa for organizing such a beautiful program. And also, it was great to see the ideas which came through the competition. And also, I would like to congratulate all the participants who have created such a beautiful video by their hard work. I'm sure they have to pass on this education and show the normal general public to impart the oral health. I would like to congratulate everyone and also thank you for being a part of this. And I would also wish all the best to the new innovative ideas will come to everyone.
Thank you, judges, for your immense help. Dr. Sachin, sir, and Dr. Daya, thank you for your time. Now, it's time for the announcement of results of the Oral Hygiene in Short video competition. And for this, I request Professor Dr. Anil Melath, sir, to declare the winners, beginning from third place. The third place for the Oral Hygiene competition in short video competition goes to Sir
AJ Institute of Dental Sciences. Congratulations, Dr. Nilan and team. AJ Institute of Dental Sciences. And the second place goes to MCOTS Mangalore. Congratulations, Ashita madam and team MCOTS. And the first place goes to Any guess? Srinivas Institute of Dental Sciences. Congratulations, Chandani and team. Congratulations, Manoj. Thank you.
Thank you, Anil sir. A very big congratulations to all the winners and more importantly to all the participants. We would now be streaming the second place prize winning video. That is the video of MCOTS Mangalore.
Kuchu, wake up, Kuchu. Brush your teeth and have your breakfast.
Oh, mommy. Oh, mommy. Oh, mommy. Oh, mommy, दंत मंजन तो हो मम्मी दंत मंजन तो हमरे बस के बाहर है हो मम्मी दंत मंजन तो हमरे बस के बाहर है हम पे थोड़ी दया तो करो हम डर्टी बालक है हम पे थोड़ी दया तो करो हम डर्टी बालक है ब्रश सुबह सुबह करना ब्रश सुबह सुबह करना मूड खराब हो जावत है ओ मम्मी दंत मंजन तो हमरे बस के बाहर है ओ मम्मी ओ मम्मी डेंटिस्ट बोला सबसे पहले ब्रश धो ले जरा उसमें पेस्ट लगा के धीमे से ब्रश कर ले आगे पीछे ऊपर नीचे मन भरे नाइन्थ फ्लॉस कराए हर रोज बच्चे बोले खत्म कीटाणु टंग क्लीनिंग नो मोर माउथ वॉश करने के बाद भी इनके नाटक है माउथ वॉश करने के बाद भी इनके नाटक है और डेंटिस्ट की धमकी और डेंटिस्ट की ये धमकी कीटाणु की शामत है ओ मम्मी दंत मंजन तो हमरे बस के बाहर है
When we hear the word health, what comes to your mind? I should not have any fever, I should not have cold, I should not have diabetes. Is anyone thinking about oral health? My gums should be clean, my mouth should be clean. No. Why that difference with oral health? Oral health should be given equal importance as general health. If we think as oral health as a window for our house, then whole body becomes the building. Is anybody wants a building with a poor door? No. Poor window? No. That means we should not neglect our oral health. What we can do as a dental professional, we can create awareness among every individual every day. So each dental professional should plan that I will create awareness about oral health one person in one day. So if we plan like this, by the end of this era, we can create oral health awareness among majority of population. What all we can tell? Simple things like brush your teeth regularly, rinse your mouth after eating anything, visit your dentist once in 6 months, take care of your oral health as a general health. With this event, we can create oral health awareness among every individual. We have started with creating this awareness with this video. Next, It's your turn. So are you ready?
Now we are going to play the first place winners video. That is Srinivas Institute of Dental Sciences video.
I had an appointment today. My name is Sarah.
Just wait in the waiting area. Okay.
Hello.
Shreya,
How many months?
5 months. What have you come here for?
No, I had visited dentist a week ago since I was having swollen gums and pus. That's why she asked me to come back with my blood sugar level checked. And it says I'm diabetic.
Oh, sorry to hear that.
Yapai, why are you here?
I just came for a regular checkup.
Is it? You should be more careful these months, okay? Yourself and your baby too.
Sarah, come in. Hello Sarah, tell me what happened.
Doctor, I have bleeding while brushing and my gums are also swollen.
Okay, let me have a look. Okay, just open your mouth. Sarah, so you have got infection of your gums. It is usually seen during pregnancy. All you have to do is improve your oral hygiene as well as brushing technique, because there is high risk of you delivering your baby before your due date as well as your baby being weak. So I suggest you to maintain proper oral hygiene. Okay?
Doctor, I have got my biopsy report.
Okay. Submit it to the assistant. As I was speaking, you have to improve oral hygiene and brushing technique. Tomorrow we will continue with treatment plan. First we will be doing scaling part and then polishing, and we will prescribe you some of the antibiotics. Okay?
Doctor, the biopsy report says stage 1 cancer.
Okay, keep it in the file. So Sarah, your treatment will be done during next appointment.
Thank you, doctor. Dentist for a checkup. Okay, bye.
Today was an eye-opener for me. I realized that oral health and systemic health are two sides of a coin. and it's never late to rectify our mistakes and lead a healthy life as a second chance. My journey of bringing out a difference in the society has started. But remember, we is always better than me. As said, oral health is the mirror of the body. If we care about our health, we can keep diseases such as diabetes, cardiovascular, cancer, and even preterm low birth weight at bay, which will bring about a holistic and a definitive change in our future generations too.
Namaste. Today, oral hygiene awareness has come a long way, and not just amongst the healthcare workers, but also amongst the general public at large. But that does not stop us, the staff and students of Srinivas Institute of Dental Sciences, from taking every step required to bring this awareness to each and every one of you. The oral cavity, unaware to you, hosts a plethora of problems that can have detrimental implications far beyond the oral cavity and extends to the rest of the body. This year, bringing this awareness to your notice is a pledge we take together.
Having good oral hygiene is just not about having a beautiful smile, but it is much beyond that. Poor oral hygiene or oral health can worsen the already pre-existing conditions like heart issues or diabetes or patients who are pregnant. So identifying the oral condition at its earliest and treating it and visiting a dental professional at the earliest is the best.
Oral health, yes, it is the mirror. Many a times see a reflection, but we have a chance to correct ourselves. Even if oral condition is unhealthy, we have a chance to go in for a good dental treatment and to correct it. By doing so, a lot of improvement in systemic health is seen. Some years back, there was no association between oral health and systemic health, but today it is a proven fact. So on this oral hygiene day, let us all pledge to use this knowledge to build a healthier community.
We are celebrating Oral Hygiene Day. It has a very important role to play because the growing burden of oral diseases demands action at every level, at individual, family and community level. And we can achieve it by making oral hygiene a personal priority for all.
We create awareness by bringing basic changes like proper dental brushing, dental flossing and regular dental visits, which helps to build a better community.
In summary, the results for the competitions. The third place goes to AJ Institute of Dental Sciences. The second place goes to MCODS Mangalore. And the first place goes to Srinivas Institute of Dental Sciences, Mukka, Mangalore. Thank you is the best form of prayer that anyone could say. Thank you expresses extreme gratitude, humility, and understanding. I now call upon Dr. Deepa Shetty, Reader, Department of Periodontics, to deliver the word of thanks.
Good morning, everyone. I thank you all here for your patience and your active involvement in today's program at this digital platform. And on behalf of the organizing committee, I take this opportunity to thank each and every individual who helped us out in making this program a successful one. I would like to start with our special mention and sincere thanks to Shri C.A. Raghavendra Rao, President of A. Shamrao Foundation and Chancellor of Srinivas University, and Dr. A. Srinivas Rao, Vice President of A. Shamrao Foundation and Pro-Chancellor of Srinivas University. We would like to convey our sincere gratitude to Srimati A. Vijayalakshmi R. Rao, Director of Srinivas Group of Colleges, Mangalore, and Srimati A. Mitra S. Rao, Secretary of A. Shamrao Foundation, for their constant support. I wish to express our gratitude to Professor Dr. Manoj Verma, Dean, and Professor Dr. Lavanya Verma, Associate Dean of Srinivas Institute of Dental Sciences, for their constant guidance and encouragement. We are grateful to Professor Dr. Anil Melit, Dean of Mahe Institute of Dental Sciences and Hospital, our special guest for today's program. Sir, you wholeheartedly accepted our invite and graced this program with your presence. And above all, thank you so much for sharing such an insightful presentation and enhancing the quality of this program. Thank you, sir.
Thank you.
We would like to acknowledge and warm-heartedly thank the ISP study group of Dakshin Kannada for their cooperation. Our sincere thanks to Dr. Sachin Shivnaikar and Dr. Daya. They were the judges for our oral hygiene in short 7 video making competition. And they so enthusiastically accepted the difficult job of doing justice to all the entries that were sent in. Thank you, Dr. Sachin, and thank you, Dr. Daya. We truly appreciate all the participants for their hard work and for creativity that they have projected in their work, and also for their commitment towards the public health awareness. We extend our heartfelt thanks to all the HODs of the Department of Periodontics and all their faculty members for their support and for encouraging all their students to participate in this competition. Thank you so much. Every program in SIDS that happens, it only happens because of the help, the effort and support of the other departments. And even this program was not possible without their help. And so I'd like to thank all the heads of the department of our SIDS family. And finally, we owe a special thanks to our team of interns who have made this possible for us to put up such a nice program. They have worked relentlessly and selflessly and have put all their hearts in to ensure that this program is a successful one. Once again, I thank you all for your attention, for making this Oral Hygiene Day a special one because of your presence. I wish you all a very good day. Thank you.
Thank you, Anil.